100 countries have been hit. A hacking attack that began on Friday in the United Kingdom has now spread across the world. Users got an image demanding $300 to $600 in Bitcoin to release the locked files. Well, here's what we know so far. 57,000 infections have been reported worldwide. Some 100,000 computers have reportedly been disabled. Now, victims include hospitals, government and corporations such as Spain's Telefonica, the UK's National Health Service, Russia's Interior Minister, the shipping company FedEx and car makers Renault and Nissan. But only a small number of attacks have been registered in the United States. And incidentally, the hacking tools used in this attack was developed by the US National Security Agency. Well, the worst affected in the UK was the NHS. TRT World's Sarah Firth went to a hospital to find out why.
Well, yes, we're here outside the Royal London Hospital, as you said, and the major disruption continuing today for hospitals across the UK in the wake of this global cyber attack. Many countries, not just the UK, Russia, Ukraine, Spain, Portugal, also affected by this. As we said, that major disruption continuing and big questions being asked as to how this was able to happen. Now, the National Health Service here in the UK thinks it wasn't specifically targeted, but it has appeared that the hospital software was particularly vulnerable, and that has caused really major disruptions. Now, I'm actually joined by Dr. Krishna Chinthapalli, who wrote an article that was published just the day before this cyber attack in the British Medical Journal, targeting this issue of hospital vulnerability to this type of ransomware. Why is it that hospitals are so vulnerable to this ransomware?
So, good morning. Firstly, as you rightly said, this particular attack seems to be indiscriminate and not targeting hospitals. And I cannot speak about specific hospitals, but you're right, hospitals are particularly vulnerable. And there's a couple of reasons for that. Firstly, they are big organizations that use computers for almost every aspect of patient care. And as I say in my article, so blood test results, imaging test results, clinic letters with the diagnosis for patients, even some of the software they use to operate some of the machinery for doing imaging tests, for example. So when a system goes down or is encrypted and hospital administrators and users cannot access it, then it's imperative that we get that up and running as soon as possible. Otherwise, almost certainly patient care may be affected adversely. You were able to identify that this was a threat.
IT experts have been saying for a long time, they've been making these warnings that this is a big threat. Why were hospitals in the UK not prepared for this cyber attack?
Well, as you know, we're operating in a time of severe financial pressures, and unfortunately, in a time where we're having to make efficiency savings, hospitals may well be looking at their IT budgets, and they may have borne some of the brunt of this, which is unfortunate. And I think, unfortunately, IT departments may not have been as aware of this threat, or certainly did not think it was going to happen to them. But we're looking at trends. We do know this is exponentially increasing over the last couple of years. And certainly this is a wake-up call for all NHS organisations across the country.
Okay, thank you very much for joining us. And as we said, the global hunt will now be on for the people behind that cyber attack that has had a global impact.
Now, the software used in the attack is known as WannaCry. It's a form of ransomware, meaning it holds onto data in exchange for payment by the system user. It's directed at Windows operating systems, which went unprotected against the software until an update was released earlier this year. The ransomware was released in April by a hacking group who studied code used by the US National Security Agency. It's also known by the names WannaDecryptor and WCry.